This is Dr. Mubin Syed, your Desidoc, and today we are going to do an expert spotlight as part of South Asian Heritage Month. Today we'll be interviewing Dr. Ambareen Jan, who is an OBGYN in practice who specializes in laparoscopic surgery and who has many patients with PCOS, and she also happens to be of South Asian origin. How are you, Dr. John?
I'm doing good. Mubin,
Great to
thanks for
have you
having me.
here.
Thank you for having me here. I'm happy to be here.
Yes. We can start. Today, our topic is going to be PCOS and South Asian women.
Yeah,
Can you first maybe explain, what is PCOS and what are the signs?
sure. PCOS stands for Polycystic Ovarian Syndrome. It's a condition where the ovaries produce an excess of male hormones, which typically is a very small amount in women. And it presents in different ways. Sometimes the hormonal imbalances can present as irregular cycles or absent cycles. Sometimes it's excessive hair growth in women, like in the chin, the chest, the abdomen, acne, infertility.
Mhm.
So it can present in many different ways. And the syndrome gets its name because these excess in hormones can cause multiple cysts to form on the ovaries. And so that's where polycystic ovarian syndrome gets its name. Cysts can usually, these cysts can be asymptomatic and you wouldn't even know that you have them, but occasionally they can grow and that can present as pelvic pain and pressure.
Oh, okay. Are there some specific characteristics in South Asian women to be aware of?
Yeah, so we're finding that in South Asian women, they are presenting at a much younger age. And they also typically present with more severe hirsutism, which is excessive hair growth that indicates the elevated testosterone in the blood. So that's how the South Asian women are typically presenting.
Okay. Um, and what causes PCOS?
We don't know the exact cause of PCOS. We do know that there is a genetic link. So if your mom or your sister had PCOS, you are at higher risk of getting PCO. We also know that there's a link between obesity and insulin resistance. When you have insulin resistance, you have higher levels of insulin in the blood,
Mhm.
and this can cause the ovaries to produce excess androgens like testosterone. And
Mhm.
so for South Asians who are already sort of a higher risk for having things like diabetes, obesity, we're now finding that they're also at having a higher risk of PCOS.
Ah, interesting. Yeah.
Yeah.
Um, and by the way, would you mind just adjusting your camera just a little bit? I think I'm getting we're cutting off the top. Yeah.
Oh, let me see here. For some reason, is
Okay,
that
perfect. That's
better?
better. Okay, great.
Okay.
Okay, next question. What are the chances of getting PCOS, and in particular for South Asian women? How frequently is it seen?
Yeah. I can't say an exact number, but we do know that in the general population, it's about 1 in 10 women have PCOS.
Okay,
And
outside of South Asians, of course.
outside of South Asians, yeah.
Yeah.
And then what we're finding in some more recent studies is that South Asian women are at elevated risk. So there was a study done where they compared the prevalence of PCOS in Chinese and Filipino women, compared
Mhm.
and compared that to South Asians, and the prevalence was about 1% in Chinese and Filipino women versus 3%, roughly 3% in South Asians. And then they did another study in the UK. It was a very small sample size, about a couple hundred patients, but they did show that 50% of those women had the appearance of polycystic ovaries on ultrasound. So we are, we do have the data now to show that South Asians are at elevated risk.
Well, that's pretty significant.
Yeah.
Um, Tell me or tell us, how is PCOS diagnosed?
So the Rotterdam criteria is widely accepted.
Mhm,
There's three parts of that, and you have to have two out of the three criteria. So the
mhm.
one is what we mentioned earlier is polycystic ovaries on ultrasound. They have a very typical appearance on ultrasound. So that's one criteria. The second is elevated testosterone or androgens in the blood,
Okay.
or signs of elevated androgens like hair growth, acne, that type of thing. And then the third criteria is irregular or absent periods.
Oh, okay. All right. What is the treatment for PCOS?
So because PCOS can present in many different ways, we definitely individualize the treatment. The first line is usually birth control pills if you're not trying to get pregnant, but we have several medications to address the different elements of PCOS. Um, I think for South Asian women in particular,
Mhm.
lifestyle is a really critical component to the treatment of PCOS. We know that people who have PCOS, they're at elevated risk of cardiovascular disease, diabetes, high cholesterol. So, as you know, the South Asian population already at higher risk for these diseases, and also for the infertility piece, we know that if you lose even as little as 5% body weight, that
Uh-huh.
it can improve fertility, increase ovulation. So, not eating out as much, learning how to cook in healthier ways, exercise.
Mhm.
It's all very critical in PCOS in general, but I feel like in particular for South Asian women.
Huh. Okay. Well, that's great. Wh- Is there, what about the underdiagnosis in South Asians? Is that something that's often, are you, have you been hearing about?
Yeah, I think that there's an underdiagnosis in general for any condition in women's health, like
Yeah.
notoriously. But I do think, for South Asians in particular, I mean, in our generation is getting better, but sometimes these topics are still very taboo, or people feel ashamed to talk about things, especially the conversations around fertility.
Hmm.
So I think definitely just the earlier the diagnosis, the better the outcome. So
Yeah.
if you have these symptoms, to really address it with your physician and get an early diagnosis, not only for the diseases like diabetes and things like that, but also for fertility, especially
Yeah.
the earlier the diagnosis, the better the outcome. So
Okay. All right, great. I really appreciate your coming on today, and thank you so much. This is really helpful. I hope this helps a lot of South Asian women out there.
thank
And
you.
thank you so much for your time.
Thanks, Mubin.
Yeah, appreciate it. Take care, Ambreen.